Today when I'm here, they are telling me that to pay $250. That's why I'm surprised.
Vida, not her real name, is a middle-aged woman battling breast cancer. Her biggest worry now is she spent all her savings battling the disease. Now her business is on the verge of collapse.
All my money is finished. So yesterday when I came, they told me that the money is covered for insurance. So I'm glad that my money is working for me. Today, they told me that to pay the $250.
It's Vida's 5th time at the radiotherapy unit of the Kolebu Teaching Hospital. She's being asked to pay 250 Ghana cedis before she's given medication. Even though she's covered under the National Health Insurance Scheme, she will not be administered the Herceptin injection until she pays the money. She's issued with an invoice containing facility user fees and chemo. The Global Cancer Incidence, Mortality and Prevalence, Globacan, estimates that 16,000 cases of cancer occur annually in Ghana. In 2018, the Ministry of Health and the Swiss-based Roche Pharmaceuticals signed an agreement aimed at making Herceptin free for breast cancer patients under the National Health Insurance Scheme. Country Director of Roche, Philip Addison, said the partnership between government and the Swiss company was to eliminate the cost barriers faced by breast cancer patients in Ghana.
What we had given the government was supposed to be completely reimbursed by the NHIS, so that patients would not have to pay. So that money would not be a barrier for any woman or any patient who would need Herceptin for breast cancer.
But Joy News checks reveal since November last year, health officials at the radiotherapy unit of the Kolebu Teaching Hospital have charged patients 3 different unapproved fees before administering the Herceptin injection. In one encounter, 2 patients were charged separate amounts, 250 Ghana cedis and 200 Ghana cedis. On the 14th of November last year, before assessing breast cancer medication, these monies were meant for facility user fees and chemotherapy, though none of the patients was offered chemotherapy. One of the patients we have decided to call Veronica said she sought explanation from the authorities at the radiotherapy unit of Kolebu on why she was charged for a treatment which was meant to be free. She was told the money was meant for consultation. She says,
there is another one looking at your condition. There is an injection they give you, and for that one, NHIS covers it, but they still let you pay some amount to cover part.
If NHIS covers it, then it suggests that you don't have to pay anything. Have you asked them why they are making you pay when it's supposed to be free?
When you ask them, they tell you the radiotherapy unit is not, they don't take NHIS. So for their consultation and other things, you have to pay for it.
I have seen on the receipt that there is a cost for chemo. When you take the injection, when you pay the 200 cedis, do they conduct chemo on you?
No.
The Chief Executive Officer of the Kolebu Teaching Hospital, Dr. Daniel Asari, says his office isn't aware of these charges and has not sanctioned them. But head of the radiotherapy unit of the hospital, Dr. Joel Yane, tells us the patients are not supposed to pay these fees. The discrepancy was caused by delays in relaying the information to the facility not to charge breast cancer patients after government entered the agreement with Roche to absorb the cost related to breast cancer treatment in July last year. We began the investigation into the payment of these unapproved fees in November 2019. It means this delay Dr. Yane talks about has persisted for 5 months while patients were paying monies they weren't supposed to. Next, we traveled to the Ashanti regional capital, Kumasi, to ascertain how the free breast cancer care program was being run there. We met Ajua Kunedu, not her real name. She's one of the breast cancer patients accessing care at the Komfo-Anokye Teaching Hospital. She was charged 60 Ghana cedis for breast cancer treatment.
And almost sick. was saying, "Woman, panny, panny, and a bomb, Miss Srim, and an also in a boarding pie, and this are buying a boa. I must have panny any day, and Jiska. Yen Jiskanty, now what you mean, Sabia, Namako, now what you mean, Sabia.
Nti obia enje wuska efa panne ne ho.
Pacho there be, and answer me could you me food that me chat 10 CD. Me chat 10 CD. Now me call panne so and me chat 20 CD. And answer na 3 weeks in the best of the 3 days time, answer na 3 weeks in us, and I'm a call lab. And then me chat 30 CD. Na medical. It's medical chair doctor we answer na ya wo me panne no so.
Ajua Konadu was also not supposed to be charged these fees under the existing agreement. A report on the implementation of the project to include the Herceptin injection on the medicine list of the National Health Insurance Scheme added the injectable at a reimbursable cost of 3,914 Ghana cedis to radiotherapy units of Kolebu and Kath. Sources at the National Health Insurance Authority tell us these units of the hospitals make 300 Ghana cedis in excess profit per vial of the Herceptin injection they administer to breast cancer patients. Head of the Oncology Department of Kath, Dr. Osebonsu, disclosed the monies charged breast cancer patients would go into the unit's development fund. Clinical oncologist at Kath, Dr. Frances Margaret Williams, sheds more light on the rationale behind the fees charged breast cancer patients.
Every time a patient comes in to see a doctor, as in for a consultation, we have what we call a ward fund. The ward fund is meant to manage the place, as in you come, you want to use the washroom. After using the washroom, you need soap to wash your hands, some tissue. If a light bulb is not working, it's not now that we have to run to central management. We have to be able to do very little things. So we rely on that money to do those very little things. So every patient pays 10 cedis for the little things that we need to get the place running. So every patient pays that. And then for the patient on Herceptin, we pay the other 10 cedis is for the consumables. To get any injection, you have to give it sterilely. So the consumables that we need to give the medication under sterile conditions. Yeah, basically, that's what that 20 cedis is meant for.
But Country Director of Roche, Philip Addison, says this defeats the purpose of the program to provide free medication for the hundreds of women living with breast cancer.
That would be odd, because I wouldn't understand why. I wouldn't know why they are paying, because they are not supposed to pay.